On this Wednesday night, ready, set, vaccinate. How prepared are provinces to immunize people?
Alberta has actually done a real service for the country by being a poster child for how to do it wrong.
The failures so far and the improvements already made. The Prime Minister's new admission, who knew what, about the allegations of misconduct against Canada's former top soldier. Catalytic converters are hot commodities. What's driving thieves to steal this vital vehicle part? Plus, tired of the pandemic?
Totally not doing the Zoom happy hours anymore or drive-by birthdays.
One man's mission to cheer people up around the world.
Global National with Donna Friesen.
Good evening and thanks for joining us. We begin with the ramp-up of Canada's COVID-19 vaccine rollout. After a rocky start in some regions, governments are promising faster and smoother operations as more vaccine doses arrive and mass vaccination clinics get underway. 4 vaccines are now approved for use in Canada, but there is still no timeline for when the first shipments of the single-dose Johnson & Johnson vaccine will arrive. The Federal Vaccine Task Force says 8 million doses of the other approved vaccines will arrive by the end of this month.
Canada is getting ready to go into the ramp-up phase after a steep increase in vaccine availability. The provinces have assured us that they're in a very good position to scale up.
As of tonight, more than 2.6 million Canadians have received at least one dose of a COVID-19 vaccine. That works out to roughly 5.4% of the population. The rules around who is eligible for a shot and how to book appointments depends on where you live. There is a patchwork of phone and online booking systems in place across Canada, and not all of them are working smoothly. Heather Yourex-West has tonight's top story on the problems and whether the provinces are prepared to handle more doses.
2 weeks ago, the frustration was palpable.
It is 2021. They knew 230,000 people were going to be applying.
On February 24th, Alberta's online and telephone booking systems were quickly overwhelmed. On Monday, BC residents trying to use the province's telephone booking system felt similar pain.
I was cut off at 3 hours. So I just got the dial tone again.
I know almost every system that's gone live across the country, across the world, in fact, has had challenges. Undoubtedly, we will have some.
Ontario's online booking platform is set to launch Monday as that province pushes towards getting 2 million people vaccinated by the end of the month. But the rollout won't rely on public health clinics alone.
As of Friday, over 325 pharmacies will be offering the AstraZeneca vaccine to Ontarians.
Bringing pharmacies into the vaccine rollout plan has helped Alberta improve its system too. It's also added call center capacity and upgraded its online platform. And appointments for the AstraZeneca vaccine will only be available for a limited number of people every day.
As we will only receive 58,500 doses of AstraZeneca this week, we cannot book everyone at once, as there are approximately 400,000 Albertans in that age group. This is why we will begin opening bookings based on the year you were born.
It's made for a smoother process this time around, with far fewer complaints.
I think Alberta has actually done a real service for the country by being a poster child for how to do it wrong. Now they fixed it, and hopefully other provinces will learn.
Because the rollout has really only just begun. Heather Yourex-West, Global News, Calgary.
BC is taking a new targeted approach with its vaccine rollout to try to get cases in a northern community under control. Starting next Monday, a vaccination spree will get underway in the Prince Rupert region. The goal is to get everyone who is eligible vaccinated by April 1st. The port city near the Alaska border is struggling with a stubbornly high positivity rate. Public health officials hope accelerating the vaccine rollout will help. The Ontario government says it is considering sending more vaccines to Thunder Bay, where case numbers are also rising fast. In the span of a month, the number of confirmed COVID-19 cases per capita in Thunder Bay has more than quadrupled. The region's top doctor says the virus is essentially everywhere in the community.
There is no sense in sugarcoating it. Things are not looking very good right now. We are in the worst situation we have ever experienced here so far in this pandemic.
The Ontario government says it is sending more people to the region to help track cases and contain the spread. And in Toronto, a temporary field hospital is being set up outside Sunnybrook Hospital in preparation for a possible third wave. The 84-bed facility is being set up in a parking lot. It's split into pods, able to hold 8 to 10 patients each. The field hospital is equipped with medical supplies, including ventilators and portable X-ray machines. It's expected to be used for patients awaiting placement in other health centers, as well as recovering patients not in need of acute care. The facility is expected to be up and running next month. A big part of the concern around COVID-19 is the spread of those more contagious variants. There are now over 2,600 confirmed cases of the variants of concern in Canada. The one first detected in the UK accounts for the bulk of those cases, followed by the variant first discovered in South Africa. And there are now 31 known cases of the variant first detected in Brazil. The situation in Brazil is grim. It set a record today for deaths from COVID-19. More than 2,000 people died in a single day. Brazil has now overtaken the U.S. as the country with the most daily COVID-19 cases and deaths in the world. Every corner of that country is affected, and the highly contagious P1 variant is driving the spread. As Crystal Goomansingh reports, hospitals and morgues are being pushed to the brink.
Hospital beds are at a premium in São Paulo. Even this emergency field hospital is full. With hospitals running out of space for the sick and dying, the state, for the third time this month, announced additional beds. This time, it's 338.
Não temos nenhuma razão de qualquer tipo de celebração.
The governor says today we don't have any reason to celebrate. If anything, it's opposite. This week, people in the country have experienced a record number of single-day deaths. Brazil has been ravaged by the pandemic with the second highest death toll in the world. Pamela Gabriela Orcoso lost her father to COVID-19. Every minute, a family member is lost, she says. This is not normal. This cannot be trivialized. The P1 variant is a critical factor. The strain is believed to be different enough from the original virus that reinfections are occurring, and it seems to be more contagious. The rapid spread in Brazil puts everyone at risk. The more people are infected, the greater the chance the virus will mutate, possibly into something more transmissible or into something current vaccines can't protect against. Vaccinations are underway in Brazil, but supplies are limited and the rollout poorly planned. Last week, a line stretched 7 kilometers from a vaccination site in Rio de Janeiro. People were irate that loved ones over 60 were forced to stand in line for hours. Crystal Goomansingh, Global News, London.
There are new revelations tonight about sexual misconduct within the Canadian Armed Forces. A recently released document shows the number of reported incidents is on the rise. It could be a sign more victims now feel comfortable coming forward. And as Mike Lecouture explains, the problem may be more extensive and more well-known than some in authority are willing to admit.
My office was aware of the minister's direction to the Ombudsman.
For the first time, the Prime Minister admitted that back in 2018, someone in his office knew the Defense Minister was dealing with allegations facing the country's former top soldier. Previously, the Prime Minister's office repeatedly told Global News they had no knowledge of the allegations. Former military ombudsman Gary Walborn told a parliamentary committee he tried to show evidence related to the allegations to Defense Minister Harjit Sajjan, but he was instead directed to the Privy Council office. Trudeau maintains he and his office only knew about the process, nothing more.
But my office and I learned of the details of the allegation through news reporting over the past months.
Still, knowing there were allegations about former Chief of the Defense Staff General Jonathan Vance, Trudeau and his office gave Vance a raise in 2019. Now, it comes as documents show an increase in the number of reported incidents of sexual misconduct in the military over the last 2 years. There were 256 in 2018-19, and then it jumped to 356 the following year, a 39% increase.
I think we are only aware of the tip of the iceberg, only because most people don't report it.
Retired Colonel Michel Drapeau runs the only military law office in Canada. He says the system of reporting misconduct is broken because it's dealt with by the military, leaving victims with no other option. There are growing calls for an independent investigative body with an extra level of accountability.
There's that longer process of cultural change, which also deserves an external oversight mechanism so that change is monitored and there is some system of accountability in place.
In response to questions about reducing barriers to reporting complaints of sexual misconduct in the military, a spokesperson for the department said important steps have been taken, but they acknowledge there is more work to be done. Donna.
Mike Couture in Ottawa, thanks. The federal government announced today it has hit a milestone bringing clean water to Indigenous communities, but wouldn't commit on a timeline for lifting the remaining long-term drinking water advisories on First Nations reserves. The Trudeau government was elected in 2015 on a promise to eliminate all drinking water advisories by this year. The government will miss that target, but Indigenous Services Minister Mark Miller says 101 drinking water advisories have been lifted since 2015, and work is underway to lift 58 others in 38 different communities.
We're in it for the long term. The work doesn't stop once advisories are lifted. We're also making investments in expanding water infrastructure and operations, in maintenance and training programs to ensure we never find ourselves in this situation again.
Ottawa has set aside $1.5 billion to complete the work. Ontario has the most drinking water advisories, 26. Manitoba, Saskatchewan, and BC also have advisories. There is also a new federal website to track progress on eliminating those remaining advisories. The military reservist who stormed the gates at Rideau Hall in Ottawa last year, while armed, has been sentenced to jail. Corey Huron has been given a 6-year sentence, and with credit for time served, he will spend 5 years behind bars. He's also banned from owning any firearms. In July, the 46-year-old rammed his truck into a gate at Rideau Hall. He then headed on foot toward the Prime Minister's home, armed with several weapons. After a lengthy standoff, he was arrested. Hawaii's state of emergency coming up, the disaster after record rainfall, plus a precious car part targeted, how to put the brakes on thieves. These streets on the Hawaiian island of Maui turned into raging rivers after some of the heaviest rainfall in more than a quarter century. Parts of Hawaii recorded half a month's worth rain in a single day. There's extensive damage to homes and roads, and a state of emergency has been declared. The weather system is expected to remain over the islands through tomorrow and possibly into the weekend. Police in many countries are dealing with a rash of thefts from vehicles. It's not what's inside them that's being targeted, but what's underneath. Catalytic converters reduce emissions from gas-powered engines, and they contain tiny amounts of extremely precious metals, so precious they're worth more than gold. Eric Sorensen explains what that has led to.
The thieves work quickly in cities all over the country. They like bigger vehicles, they're easier to get under. At this heating business in Guelph, Ontario, they made off with 7 catalytic converters in one night.
Our service tech started to start up the trucks. The next thing you know, all the trucks were just making so much noise, there was no exhaust systems on them.
This is what they're taking.
That's the catalytic converter.
It costs thousands to replace. Its value is first to the environment. Traditional engines burn fuel that produce harmful fumes like carbon monoxide and nitrous oxide. The catalytic converter transforms much of it to less harmful carbon dioxide, nitrogen, and water. The catalyst is a metallic core made of precious metals like platinum, rhodium, and palladium. Just a few grams, but the value. 12 years ago, palladium was worth about $200 an ounce U.S. Gold, by comparison, was $1,100. And while it has risen to around $1,700, palladium has rocketed to more than $2,300 an ounce, more valuable than gold.
The nuts are on the ground here.
And it's accessible under millions of vehicles.
So all you have to do is pop one end off.
A dozen trucks at this Dodge dealership in Langley, BC were stripped of their converters, as were several buses at this non-profit children's agency in Calgary. One scrapyard dealer suggests there's a black market for unscrupulous operators.
When the prices go up, the theft goes up.
Thousands of converters are being ripped off. Insurers are looking for ways that manufacturers can embed identification on the devices.
Because right now,
These units aren't marked in any way, so if it's marked and traceable back, it'll hopefully diminish their ability to get rid of some of this product.
Police advise where possible, park vehicles inside or in well-lit areas, or where there are cameras. Because with prices as high as they are for precious metals, even a few grams from several converters can be a lucrative night's work for thieves. Eric Sorensen, Global News, Toronto.
Caring for healthcare workers. Still ahead, the burnout behind Canada's pandemic front line. As we approach what appears to be a semblance of normal life, there will be a need to take stock of what's been lost in the last year, including the toll on those who care for COVID-19 patients. The physical and psychological strain has left some deep wounds and will take time to heal. Tonight, Karen Lieberman has some of their stories.
When it became clear there was a need for help on the front lines, Kelly Cray answered the call.
We're right there at the greatest risk.
As a respiratory therapist, Cray is a crucial part of the fight against COVID-19, helping patients to breathe and often providing comfort as they take their final breaths.
We see them at their worst, and we hope we get them through it with as minimal amount of casualties as possible.
She says it's been an emotional roller coaster. Certainly, she's not alone for the ride. The pandemic has presented an unprecedented challenge, not just for society, but for those providing the public health response.
As healthcare workers, just all very burnt out from the mental burden, the emotional burden.
Being on the front line, caring for patients with COVID-19 and navigating a year-long global health crisis adds even more pressure to an already high-stress job. Emergency physician Shazma Mathani has had to balance the needs of her patients with the demands of her young family. Recently, she gave up a shift because she needed a mental health break.
I didn't have the ability or the resiliency to bounce back the way that I had before the pandemic.
Dr. Jillian Horton just published a book about her own struggle with burnout. We Are All Perfectly Fine asks the question, when we need help, we count on doctors. But what happens when doctors fall apart?
Physicians are really bad for this in terms of how we talk to one another, how we inquire about how our colleagues are doing. We don't have a culture where we talk a lot about the times when we're not doing fine.
That can be especially problematic because burnout may be easily hidden behind the mask.
So we're bearing a huge burden of caring, and I think it's compounded by the fact that we're working longer, we're working more.
Dr. Julianne Irving specializes in physician wellness and is getting referrals from doctors needing support and feeling exhausted.
People might not have full-blown PTSD, but are certainly having some of the symptoms. So not sleeping as well, feeling chronically anxious, having difficulty turning their fight or flight system off.
If anyone understands trauma, it's Kelly Cray.
What the public sees through the camera is not necessarily what goes on here. It is tiring, frustrating.
And that takes a toll. Karen Lieberman, Global News, Toronto.
Tomorrow, Karen looks at how healthcare workers are finding creative ways to cope with burnout. Staying hopeful at home. Next, the Canadian who just keeps dancing.
You're watching Global National.
Politicians sometimes dodge reporters' questions, but Thailand's prime minister took it to a new level. During a news conference, he was asked about a possible cabinet shuffle. He not only refused to answer, he then sprayed the front row of reporters with sanitizer. The quick-tempered former army commander who overthrew the elected government in Thailand in 2014 is known for his impulsive behavior. Well, lots of people are short-tempered and tired these days, and it's no wonder after a year of living through the pandemic. Of course, it is wise to look for the positives, and some of us have embraced spending time at home, but let's face it, puzzles, baking, and binge-watching can only keep you interested for so long. Mike Drolet examines the ups and downs of the last year.
Remember the shock of that first lockdown? We went from bustling cities to eerie quiet overnight.
But we adapted, even embraced the isolation by spending more time doing family activities. We took up hobbies like baking, so many goodies big and small, and the fails, they were even better. But as the weather warmed up, the luster of the virtual began to fade.
I just can't be on another Zoom call. I almost refuse. I'm like, I'm over it. I'm over Zoom.
And that was the beginning of the slump.
I'm not a cat.
By winter, it was on full display as participation in virtual or distance events bottomed out.
Definitely, totally not doing the Zoom happy hours anymore or drive-by birthdays.
You can't sit in one bed in a bachelor watching TV all the time. You have a cigarette, then you end up smoking all cigarettes, and it's not good for you.
But the slump was more than frustration and annoyance. Antidepressant prescriptions went up 20% according to some insurance companies, and even the most upbeat people admitted to feeling down.
Yeah, I have my moments of reflections too during my daytime.
And when that happens, Gurdeep Pandher dances. Over the last year, millions of people have watched Gurdeep do traditional Bhangra dances in the wilderness near his Yukon cottage. And he's become so popular, he no longer does IT work for the government.
Like so many letters from all over the world. Right now, these are the just letters I received yesterday.
If he ever has a day when he feels a little down, he recalls messages like the one he received from a girl immobilized in a hospital bed.
And I watch your videos and I dance, I do little dancing in the bed. It was such a powerful message. I watched the video. I could, oh my God, it's really huge.
Yeah, it's huge. And hopefully all of this, along with the slump, is over soon. Mike Drolek, Global News, Toronto.
And that is Global National for this Wednesday. I'm Donna Friesen. Tonight's Your Canada is Hopetown on the Gaspé Peninsula in Quebec. Please email us a picture of your Canada to viewers@globalnational.com. Thanks for watching. Hope to see you here again tomorrow. Take care of yourselves. Bye-bye.